Last question, Sadia, from you. That is very important. I know you got your dream job in Manchester. Nowadays, competition ratio is high. Just to put a little bit light on MSRA, would you recommend people sitting in their country to do MSRA? And what is the competition ratio nowadays to get a direct GP training? You talked about direct locum job, and the good thing is a lot of doctors don't know to go take their MSRA straight away. Would you recommend them to do the MSRA right after their PLAB-2 exam?
Zeeshan, again, a very good question. And I see a lot of people moving from their country to NHS nowadays by taking MSRA. They score very high nowadays because they are sitting at their home country. It's much more comfortable at their homes. And they have more time to prepare for MSRA as compared to a doctor who is working in NHS and then preparing for it. I may be biased about it, but to be honest, I do not recommend doing MSRA from your home country and then moving here, because once you get into the training, it gets a bit tricky. But again, it depends. So, for example, some people jump to locums directly because they feel it is in them and they are confident about it. So, if you're somebody who can work unsupervised, like in training, you are supervised, but again, you are coming, it's a big transition from your country to an entirely different country, different environment, different people, and different work environment as well. So it is a again very tricky question, and it depends. It varies from person to person. But the
Yes.
competition is very high nowadays because people from different countries because they are unable to.
Sorry, this round, there was the last person who got GP training. He got 480, and 480 used to be the dream merit. People used to get it.
Yeah. 480 was my marks were around 480, and that is how I got into the Manchester. And I didn't, to be honest, I didn't study very hard about it.
It's quite
So 480 was an
unfortunate
easy
anyway.
target. But nowadays, even 500 doesn't get you anywhere near to a big city.
Okay, so I have a bit of you said that you shouldn't do, but I would recommend take MSRA as many times that you want, even while sitting in your country. But if in the market when you already is not getting any job, and it's better to take MSRA, at least you'll get the
Yeah,
job.
that's true. Yeah, if you're waiting for a long time, and again, if you feel confident, you can come to a different country and work under stress. Like in training, you have admin work along with the clinical work. So if you feel like you can do it, definitely do it. Go for it.
Okay, so somebody asked what is MSRA, Savira, can you put a light on that? Because a lot of doctors.
Um, yeah, so MSRA is like an entry exam. I'm doing GP training in Manchester, and I'm already not halfway, but I have done 1 year of my training already. So basically, MSRA is entry exam. It is used for all the trainings here, but for GPs, you don't need a very big CV. MSRA is the main streaming through how you get into the GP training. I think this is a multi-specialty recruitment assessment, something like
Yes,
that. It
yes,
stands
exactly.
for.
I just want to add on one more thing on that. I will explain locum doctor as well. Just a because if you make your target of what you will do after PLAB2, these are the few things. MSRA is an exam which will help you to get different training apart from IMT. IMT mean internal medicine training. They don't need MSRA. Surgery do need a MSRA if you want to become a surgeon here. You if you want to go in emergency medicine to get a training, you do need MSRA. Radio do need MSRA, and it's highly competitive. For example, if you need want to become emergency medicine doctor, you should have at least 520 something score to get shortlisted for interview. So GP has a full for the GP is only MSRA. The full merit would be MSRA, but other specialty they take different percentages from that score, and that will be so. Once you're done with your exam, just know more about MSRA, and in future we are planning to start a course as well, Sadia, me, and few other doctors, so that will guide you through. So that would be in the start would be very free, very cheaper. So that's fine. The last question, Sadia, I'm sorry for asking too many questions
No,
regarding
that's
PLAB.
fine.
PLAB-2 practice, that is a very specific question. Then I'll introduce my team. Dr. Ramesh is here. I can see she's a very brilliant doctor. Dr. May is here, and might be Dr. Rafiq and Dr. So we have, I will explain what is simulation-based teaching. I'll tell about that. But one thing I want you to answer and help our doctors, tell them how they should spend 8 minutes in exam like condition, or before that exam condition, how should they practice 8 minutes for different scenarios. And definitely you will be giving feedback, and you will be doing one scenario as well today, as how you do approach a patient as a GP setting. Okay, so how would you, what would you recommend how they should practice those 8 minutes? So my like whole focus is that.
Is it regarding the practice or how you should spend those 8 minutes in the
Yeah, 8 minutes
session?
and how you should practice before your exam and how you would do when you are in your exam condition.
The first and foremost thing is your body language. You might know a station very well inside out, but if your body language is not open and if it is not friendly and warm, you might not score very good in that. So first of all, your impression in every station starts by the time you enter that room. You know what I mean? Like when you enter, you should be smiling, have a open body posture, and then there should be a smile on your face. That is very important. So first of all, just forget about the 8 minutes and focus on your body language, how you feel about that. And then once you start it, Zeeshan, I think there used to be an exam. Is it like you are scored based on your management and treatment, and then your
IPS,
uh,
IPS history and management.
yeah. So try to divide your time according to that as well. Like first introduce yourself and then spend 3 minutes trying to explore what is the station is about, and then spend another 2 minutes explaining to the patient what you have found out in the consultation so far, and then the other 3 minutes in explaining to them about the management, and try to summarize the scenario to them and try to find out what they have understood so far from the consultation. So I think more to the the material, you should focus on how you are delivering that material as well. That is very important.
Okay, so Svera, regarding the patient, so you might be seeing a different age group patient in your training in the GP. So what tip you will give doctors how they can like build their rapport with the patient? As a GP, you have gone through, you might have learned a lot of things on that. So how do you feel that at the end of consultation, you can see on the face of patient that they are happy? How you can like improvise, how doctors can improvise that at the end, the simulators, that actor that become very happy in terms of IPS.
So Zeeshan, all of us, all of the doctors coming to UK, they're coming from different backgrounds, different cultures, and different environments. But one thing that is common everywhere is empathy. Like in every culture, empathy is something which is common, and you have to be empathetic to the patient. And other than your language, like your verbal communication, you can show it by your non-verbal communication. So try to, and in non-verbal communication, the most important thing other than smile is that the patient should feel that you are listening to the patient. When we are doing the station, we have memorized all these things, Odipara, Socrates, and we focus on just delivering and getting done with these things. But we forget how the next patient or the next person sitting to us is feeling about it. Exactly. So you should focus on how, other than how on your English and your communication skills, you should focus on how you are listening to the patient and how you are making the patient feel that he is being listened.